Hi guys, welcome to coronavirus quarantine, and we are returning to work. We have been working, I have been working while this has been going on. So some patients have severe intractable pain and they just can't tolerate it anymore. They don't want to get addicted to narcotics. Some people have neurologic deficits and pinched nerves that need to be fixed. So we are operating primarily in the surgery centers where there are no coronavirus patients, separate from the hospital. The Department of Health has had us move patients over there, so it's probably the safest place to have surgery. Secondly, I've already had coronavirus. I've been antibody tested several times. I'm positive. So I have the long-acting IgG antibody. I'm immune. I can't give it to you. I can't get it. So I'm safe to be your doctor. All right, we'll see you soon.